All right, so today we're diving deep into AI in healthcare.
Right.
We've got a ton of research here, journal articles, case studies, even some public perception surveys ready to go. We're going to explore how AI could revolutionize medicine, but we'll also tackle those technical hurdles that come with it.
You know what's fascinating to me about this is how it impacts us
Yeah.
on like a large system-wide level, but also on a really personal one. We're talking about everything from diagnoses to data privacy, even like who's responsible when AI makes decisions about our health.
It's a lot, yeah. So let's start with the possibilities. One study found that an AI model, actually, after being trained on millions of mammograms, was able to detect breast cancer in its early stages with 95% accuracy. That's actually exceeding the performance of human radiologists.
Wow. That's a perfect example of how AI is shifting us towards personalized medicine, which is truly groundbreaking. Think about it. AI can analyze your unique genetic makeup, your medical history, your lifestyle factors, all to predict how you'll respond to different treatments. It allows doctors to tailor therapies specifically to you, increasing the chances of success and minimizing side effects. Especially for chronic diseases, this could be huge.
Yeah, it's like having a medical detective working behind the scenes to create the most effective treatment plan just for you. And then there's the potential impact on efficiency. AI could automate tasks like scheduling appointments or handling billing. That would free up doctors and nurses to spend more time with their patients.
Exactly. And that increased efficiency could even translate into lower healthcare costs. AI-powered predictive analytics can help hospitals anticipate demand and manage supplies more effectively, leading to a more streamlined system.
Okay, that all sounds amazing. But we have to talk about the challenges too, right? Patient data privacy is a big one. These AI systems need access to incredibly sensitive information, medical records, genetic data, even real-time health data from wearables. It makes you wonder how we can ensure that information is protected and used responsibly.
Oh, absolutely. It's critical.
Yeah.
And then you have the question of accountability. Let's say an AI system makes a mistake,
Yeah.
like an incorrect diagnosis or a treatment suggestion that ends up harming the patient. Who's responsible then? The doctor, the hospital,
Oh.
the AI developer? It gets really complicated.
Yeah, it really does. While AI shows a lot of promise in diagnostics, I do wonder about things potentially falling through the cracks. How do we ensure that the algorithms used are applied fairly and equitably for all patients, regardless of their background?
That's a really important point. One study actually found that the accuracy rates of some AI systems were 10% lower when diagnosing conditions in minority groups. This highlights the need for diverse and inclusive data sets to train these AI systems so we can ensure fairness and equity in AI-driven healthcare.
That's a good point. It's a wake-up call that AI isn't a magic bullet, and we can't just blindly trust it without considering these potential pitfalls. And what about the practical side of things? Integrating AI into existing healthcare systems isn't going to be easy, especially since so many still rely on outdated technology.
Yeah, that's another huge hurdle, getting these systems to talk to each other. And to handle the massive amounts of data AI requires, it's a major challenge.
Yeah, it's like trying to fit a square peg in a round hole.
Yeah,
And then there's the human element too. Healthcare professionals are going to need training to use these AI systems effectively and understand their limitations. It's not about replacing doctors and nurses. It's about giving them powerful new tools to make more informed decisions.
absolutely. It's about collaboration.
Yeah.
You know, healthcare professionals, AI developers, ethicists, all need to work together to create a responsible framework for AI implementation. We need to make sure that AI complements human expertise, not replaces it.
Right. Speaking of human expertise, one of the case studies we looked at really highlighted how AI can change the game for healthcare professionals, especially those who are facing intense workloads. This study focused on radiologists in a busy hospital, and they talked about the challenges they faced every day.
Yeah, radiologists are often overwhelmed by the sheer volume of medical images they have to analyze. It can lead to fatigue, even burnout.
It's a high-pressure job for sure, with a lot of responsibility riding on their diagnoses. It's easy to see how AI could help alleviate some of that pressure.
Definitely. The hospital in this case study actually implemented an AI system to assist radiologists with image analysis, and the feedback was really positive. The AI could detect these subtle abnormalities in images that radiologists might miss, especially when they were tired or pressed for time.
Like having an extra set of eyes, but these eyes are super powered and never get tired.
Exactly. And not only did the AI improve the accuracy of diagnoses, it also significantly sped up the process. That means patients could get diagnosed and start treatment sooner, which is a win-win for everyone.
That's amazing. Did the radiologists have any reservations about using the AI, though? Do they feel like it changed their role at all?
That's interesting. They actually reported feeling more confident in their diagnoses and less stressed overall. It seems like AI in this case wasn't replacing them, it was empowering them to do their jobs better.
That's a fantastic example of how AI can work hand in hand with human expertise to lead to better outcomes for patients. But this case study also highlighted the importance of training and collaboration, right?
Exactly. It wasn't just a matter of plugging in the AI and letting it do its thing. The radiologists needed training on how to use the system effectively and how to interpret the results, plus ongoing communication between the radiologists, IT specialists, and AI developers. That was crucial to make sure the system was working properly and meeting their needs.
So teamwork was really key to the success. But even with a successful implementation, they didn't just assume everything was perfect and would stay that way forever, right?
Right, they established protocols for ongoing quality control, data analysis, performance review, all to ensure that the AI system continued to meet their standards and that it could adapt to evolving needs. It's an ongoing process of monitoring and refinement.
Makes sense. All this research really paints a vivid picture of the opportunities and challenges of integrating AI into healthcare.
It's becoming increasingly clear that AI has the potential to revolutionize medicine. But it's not a simple plug-and-play solution. It requires a thoughtful, strategic, and collaborative approach. And we always have to keep the well-being of patients front and center.
I agree. One of the most important takeaways for me is that AI isn't meant to replace human healthcare professionals, but to give them new tools and insights.
Yeah, I agree. The goal is to empower healthcare professionals to make better decisions and provide even better care. After all, the human touch in healthcare, that's something that can never truly be replicated by technology.
It really can't. That human connection is at the heart of what makes healthcare meaningful. What about the impact of AI on a larger scale? I'm thinking about the potential societal implications we haven't touched on yet.
That's a crucial aspect to consider. We've talked about the technical aspects of AI and its impact on healthcare systems. But we also need to think about how this technology will reshape our entire understanding of health, access to care, even the doctor-patient relationship.
Wow, yeah, it's like we're on the verge of a whole new era in medicine, and we need to be prepared for the ripple effects.
Exactly. Like, how will AI affect access to healthcare, particularly for underserved communities? Will it worsen existing disparities or help bridge the gap? These are questions we need to be asking.
Yeah, it is kind of overwhelming to think about all the ways AI could change healthcare for individual patients, but also for the whole system.
It really is a vast landscape of possibilities and potential challenges. One of the big promises of AI is that it could make healthcare more available, especially for people in like remote or underserved areas.
Yeah. Oh, you mean like telemedicine powered by AI diagnostics? And personalized treatment plans sent right to your smartphone? That sounds almost too good to be true.
It does have that sci-fi feel to it, but that's where things get a bit complicated, you know? What if access to AI-powered healthcare hinges on having the latest tech, a good internet connection and digital literacy? Are we risking a new kind of healthcare divide?
Right, and we can't just assume that everyone has equal access to those resources. And what about the cost? Developing and implementing AI is expensive. Will those costs just get passed along to patients and make advanced healthcare even less affordable? Or will AI's efficiency actually drive down costs over time?
That's a tough question. I don't think there's a clear answer yet. That's where the role of government and policymakers becomes really important. They need to be proactive in ensuring equitable access to AI-driven healthcare, maybe through subsidies or infrastructure investments and digital literacy programs. It's a multifaceted issue that requires a multifaceted approach.
Definitely. We've talked about access, but what about the ethical use of AI in healthcare? We can't just leave that up to chance, can we?
You're absolutely right. We need regulations oversight, maybe even new legal frameworks to address all the complex issues that come with AI in healthcare.
Yeah, data privacy comes to mind immediately. We've already talked about how much sensitive information AI needs, medical records, genetic data, lifestyle habits. All of that information could be misused and potentially lead to discrimination.
That's a valid concern for sure. And then you have the issue of transparency. With these complex algorithms, even the developers sometimes don't fully understand how they work. So how can we ensure accountability when AI is involved in making such important decisions?
It is a bit unsettling to think about. Imagine being denied health insurance because an AI algorithm flagged you as high risk, based on factors you can't even control.
Exactly. These are the types of scenarios that legal experts, ethicists, and AI developers need to work through together. And it's not something that can happen in isolation. Public engagement is crucial. We need to have open and honest conversations as a society about what we want AI-powered healthcare to look like. What are our values, our limits, our hopes and fears?
It's about making sure AI serves humanity, not the other way around. And that brings us back to the human side of things. How will AI change the doctor-patient relationship? I mean, that dynamic is so central to healthcare.
Yeah, it's an interesting question. On one hand, AI could free up doctors from a lot of tedious tasks, paperwork, data entry, even some preliminary diagnoses. This would give them more time to connect with their patients, to really listen and empathize.
Some more time for those uniquely human aspects of care. I like that. But what about the patients themselves? Would they be comfortable with AI playing such a big role in their healthcare?
Well, some people might find it impersonal, even a bit scary. Others might embrace the efficiency and objectivity of AI. It really comes down to individual preferences and how well the technology is integrated into the healthcare experience.
That's true. And we can't forget about the healthcare professionals. Imagine training for years to be a doctor, and then suddenly an AI is doing a portion of your job, maybe even better than you in certain areas.
It's definitely a shift in the landscape of healthcare. But instead of viewing it as a threat, I think we should emphasize that AI is a tool, not a replacement. The goal is to empower human doctors, to give them new capabilities.
I like the way you put that, giving doctors superpowers. But seriously, healthcare professionals are going to need support in adapting to this new reality. They'll need training on how to use AI effectively, how to interpret its results, and even how to talk to their patients about those results in a way that builds trust.
Absolutely. It's a whole new skill set, a new way of thinking about medicine. Medical education and professional development will have to evolve to keep pace with AI advancements.
We've covered a lot of ground today. Access ethics, the human element. It's a lot to process. But before we wrap things up, is there anything we haven't talked about yet that you think is important for our listeners to consider?
One thing that comes to mind is the potential for AI to make us healthier, not just treat us when we're sick. AI can play a big role in preventative health care, which is really exciting.
You mean like those wearable sensors that track your health in real time? Or AI-powered apps that give personalized advice on diet and exercise? It's like having a personal health coach, but one that's powered by data.
Exactly. And with AI sifting through all that health data, we could start to see patterns and connections that were hidden before. This could lead to breakthroughs in understanding the root causes of diseases, developing new treatments, and even preventing diseases altogether.
So instead of just reacting to illness, we could be proactive about staying healthy. That's an amazing thought. But I imagine there are challenges there too.
Oh, of course. There are always ethical considerations. Like what happens if AI tells you you're at high risk for a certain disease, but there's nothing you can do about it? How do we balance the benefits of early detection with the potential for anxiety and stress?
That's a good point. It's a good reminder that technology, even with the best of intentions, can have unintended consequences. But overall, do you feel optimistic about the future of AI in healthcare?
I do. I think the potential benefits far outweigh the risks. We have a real chance to make healthcare more accessible, more effective, and more personalized than ever before. But we need to approach it thoughtfully and carefully, ensuring that AI remains a tool that serves humanity and improves our well-being.
Well said. This has been an incredibly thought-provoking conversation. Thank you for diving deep with us today.
It's been my pleasure. This is a topic I'm really passionate about, and I hope our listeners feel empowered to learn more and engage in these important conversations.
That's what the deep dive is all about. Thanks for joining us, everyone.